right, thank you so much for staying with the extended version of the Explain. It's a special day today because it's just a day to the International Day of the Girl Child. But we're talking about ending the triple threat. What is a triple threat, you may say? It's SGBV, HIV, and teen pregnancies. Tonight, we're live from the Kenya Highlands University right here in Kericho, part of the 14 counties that form the Lake Region Economic Bloc. Why? Because according to KDHSS statistics, 52% of the HIV burden is domiciled within 4 LREB counties: Kisumu, Migori, Homa Bay, and Siaya. At the same time, according to that same report, 98 adolescents contract HIV every week. That is 14 every day. At the same time, according to the same report, LREB region, 78% of the population undergoes some level of poverty, which in itself is a catalyst for the triple threat we're talking about. So a day before the International Day of the Girl Child, what we're asking is, what has been done and what more needs to be done? That's a conversation that I'll have with my panelists here, and also a great audience from the university students and quite a number of residents from Kericho County here. Let me introduce my guest one more time. Starting from my immediate left, His Excellency Dr. Eric Mutai. He's the host governor and LREB Gender Pillar Patron. Thank you so much for making time for us. Next is Dr. Ruth Laiboni Masha, CEO, National Syndemic Diseases Control Council. Asante sana for making time. Next is Her Excellency Professor Janet Baraza, First Lady Kakamega. Thank you very much for making time. And next is His Excellency Dr. Paul Otuoma, Governor Busia County and MHM champion. Thank you so much for making time. And Dr. Shaheen Nilofa, UNICEF Kenya country representative. Asante sana for making time. In the audience with me, when I talk about triple threat, you may wonder, SGBV, HIV and AIDS infection, and teen pregnancies. But let's put a face to this entire conversation. Let me bring in Vivian Chebet. Vivian Chebet is a young person, just 22 years of age, but I believe she's a hero for most of the young people because she's experienced she's at an interesting time. Let's hear from her directly. Vivian, thank you so much for making time for us. I don't want to push you into revealing anything that you don't want to. So I'll just start by asking you, what is your story, Vivian?
Thank you so much. My name is Vivian Chebet, as you have all heard. I thank God for this great opportunity that you have given unto me. Okay, as you all speak about the girl child. The girl child, who is a girl child? Of course, it's a lady who is me now. I'm 22 years. I come from Kericho County. And talking of the triple threat, I've participated in the triple threat, and I, as a victim of all those, the GBV, the HIV infection, the teenage pregnancy. Okay, I'm Vivian, born of a single mother, and having been born of a single mother, born with HIV and AIDS, I speak through the heart. It is not an easy thing. And it is not easy to live with HIV and AIDS. And not everyone will ever like you when you're positive. Especially being a positive child, have no parents, it's a hard thing. I've gone through a lot, and by now I'm so grateful because God has given me this chance to live. It was not an easy journey. I began this journey a long time ago because I'm not 22 years. But getting to this 22 year, it has been a difficult thing. I've fought and I've already fought it. I've fight for my life, something that has been a difficult moment for me. Since I have no mother, I have no love for a mother. It has been so hard. So I thank God because of the community who managed to help me. I was nearly dead, and there is one person in the community who managed to save my life, and I really thank that person because of him I breathe today. I remember there was a time I was terribly sick. Every time I could just fall anytime. You are in the hospital every time. But God has given me this chance to live. So my history is a little difficult, but all in all, I've managed my life.
Okay.
And it's not me alone who did this. There are so many people who participated in saving my life.
Okay.
So I thank them also. Even doctors have managed to help me. And since HIV arrived, I don't know which year, but my mother couldn't manage because there was no free drugs like now. Okay. You understand? So these drugs came later hours when my mom couldn't manage the life. Okay. So I used to ask myself, why did my mother decide to leave that thing for me? But I came to realize that it was difficult to get the money. Okay. Coming from a poor background, it's a hard thing. You cannot manage. Okay. So my mother couldn't manage. That's why she went off. So as we speak, I don't even know the face of her because I never managed to get time to spend with her, to see her, at least to get any experience on this life. Okay. But still I'm alive. Yeah. And HIV is not a killer disease as it was before. Since we have drugs that are free now, it is the most helpful thing that we have been given.
All right. Yeah. Thank you so much, Vivian. I think Vivian deserves a round of applause for just the simple courage to even share what she has gone through here with us. Most of us would not have that courage. And Governor Mutai, she's actually a resident here. What are some of the specific initiatives or even policies that Kericho County has implemented to empower girls like Vivian who just spoke here? Correct.
Thank you so much, Trevor. Before I respond to that, because we are celebrating the Girl Child and the National Girl Child Day as LREB, it's only fair to ask my wife to stand. Okay. In that spirit of celebration, okay, so that she can be...
Madam First Lady, we recognize your presence.
Thank you so much. Yeah. One is that the story of Vivian resonates to so many that we have in the county and even as regional economic bloc for LREB. Specific interventions that we have done as a county, because we are alive to this matter, is that we've moved to try to identify what are these things that push our girls into, you know, for example, early teenage pregnancies. And we drew a nexus between poverty and early teenage pregnancies. We have done a collaborated effort, which is actually even now spearheaded by the First Lady of Kericho County and the MCS, which are the women caucus in Kericho County, to supply sanitary pads to the children. We mapped out primary schools, mapped out secondary schools, where we have the most vulnerable girls, and we've been able to provide them with sanitary pads as a county government. Our understanding is that as cheap as 10 shillings or 20 shillings for this precious commodity, girls can mortgage their bodies who are coming from very, very vulnerable situations. So out of that, then we have made a decision and come up with structures which will see us supply sanitary pads and support those children. Yeah. Secondly, we have also moved and create community outreach. Mm-hmm. One of those is that amongst the churches that we have tapped in Kericho County, a great number of churches at the moment are offering alternative passage rights on December. And this is a congregation, or this is girls are assembled in a church, which resembles the old circumcision where girls, FGM was still those days. It is out of this where the church are able to train the girls about their bodies, to understand how to take care of themselves, and to also understand how to give voice to themselves. Just last week, I had a meeting with the judiciary, which I had called. And one of the things that we came to identify is that much of the gender-based violence are happening in the villages. But because of community stereotyping, a number of these voices are stifled. So we've reported, we've had cases in our own hospitals, facilities, where the doctors identify that is a rape case, but when you want to pursue the case, the parents has been compromised. And there is the community placement that if you come out loudly and say that this daughter was raped, then the parents would worry about what the community would think of the family and the girl, and begin to appropriate the blame to the girl. So out of this, I had a meeting with the judiciary. We are having conversation with the chiefs. We are having conversation with the village administrators, so that such cases, whenever they happen, we do not allow alternative justice system. And we agreed that we will not allow alternative justice system where a group of says there in the village drinking pusa are called in, and then they are given some 500 shillings, and they are told, let's finish this thing. But it must, be prosecuted to the end. So that it can deter the rest.
All right. And Dr. Masha, Governor is raising very interesting points there in terms of, if started by saying that sometimes young girls leverage their bodies just in exchange of sanitary towels. You have been dealing with ending the triple threat for quite some time. What is the general overview? What are some of the successes and the milestones so far that has been achieved?
Thank you, Trevor. I think the first success is accepting we have a problem. And when we started this conversation is when we looked at our data, and thanking the media during COVID time for highlighting some of the incidents we've seen. But a case in Homa Bay County, we were just sitting in a meeting like this, and someone said there's a village where they can call 200 girls aged between 10 and 19, and they would show up in a meeting pregnant or breastfeeding, and they would come from a walking distance. And I decided to go there personally during the height of COVID to see if actually those statements were true. But then before then, I started looking at the data. 2016, there were about 23,356 children aged 10 to 14 that had come to the facilities as pregnant girls, mothers. 252,777 were between the ages of 15 to 19, a total of about 275,000. By 2018, when we were feeling the crisis, there were about 427,000 from the ages of 10 to the ages of 19. And last year, after some work we've done, the successes we've seen, we have reduced that number to about 260,734. So we are celebrating very, very small milestones. But then our governor has said something. What then do we do? We realize that there are a couple of things we have to call for. One is commitment, not just from ourselves as stakeholders, but also from the communities themselves. He has mentioned the fact that it becomes so difficult to deal with an issue where there's complacency in a community, where there's a mystery surrounding, where the family is going to be blamed, where the family sometimes actually is threatened. And if you look at last year, about 21,000 cases of sexual and gender-based violence were reported in our health facilities. But if you examine the judiciary books, you're not going to find those numbers. So there's a disconnect between what we see, the statistics we have, and what actually gets reported, and then what then communities do. So we thought that this unprotected sex, first of all, is what is causing the HIV infection. But this sex sometimes is also unintended. It's because the girl never wanted to have sex. Actually, 71% of the girls, when they're asked, they say they wanted to delay sex, but something else made them want to have sex. One, they were forced. So it's something they're doing that they did not intend, but they are forced. Secondly, the circumstances. She has just explained to us. If my mother was from a rich background, we can confirm that actually the triple threat challenge is now becoming a challenge of inequality. It is a challenge that is following the poverty line.
Okay.
And this is why. For those 260,000 girls who got pregnant last year, the likely scenario and pathway they are going to follow is this: they drop off school.
Yeah.
When you come to the facility, they don't turn up to the facility. So if they got HIV during the sexual exposure, they then are pregnant, they have HIV. By the time they go to deliver, it's even too late to give them any form of prophylaxis for the baby.
Yeah.
And when you look at our data, about 50 to 60% of this mother who is likely to transmit HIV to the child is also likely not to have been educated. She's also likely to have been very young and not have the agency to even go to the ANC. Then when you move again across this girl, the child who is born to this mother begin to face similar challenges. In fact, in some of the areas we've gone, the mother of the child of the adolescent mother, as early as the age of 9, 10, she begins to face the triple challenge, all at the same time. Her mother was there, she's now young, she's unwanted, whatever place she is, because, or he, if she's a girl mostly, they, at the age of 10, there are those relatives already who are seeing this is a girl of the other child who does not have any agency, so she becomes a subject of discussion, and anybody who plays on her knows that the family lacks the power to confront. So what we are saying is that it is an issue of inequality, it's an issue of poverty, it's a lens we have to wear. If indeed we have to tackle that challenge.
Okay, and let me bring in Prof on this. Professor Janet Baraza there, what role does the First Spouses Association in LREB play in enhancing opportunities for both girls and boys? Because like what Dr. Masha is saying, this is a vicious circle that ends up being a poverty domino effect. That because you're not empowered in one way or another, you end up facing the triple threat.
Thank you, Trevor. As First Spouses in the LREB region, our main focus is advocacy. And as First Spouses, we have coined the term woman. The term woman means word of mouth advocacy network. So we use our mouths to advocate for the rights of the girl child. So we use our platform as First Spouses to speak about the rights of the girl child everywhere that we go. And we are saying we do that because we realize that most of the time, because of the triple threat, the girls miss out in school, for example. And so we want to bring the girls on board by speaking about it using our platform. But besides that, we also engage our partners. We collaborate with our partners. Mostly we have UNICEF, we have KMET, we have USAID, we have Plug Fund, who help us to ensure that these girls are kept in school. First, by helping us to run the menstrual hygiene programs in our counties. And the issue of menstrual hygiene has helped the girls to stick in school because it's the key thing that keeps girls out of school. For example, I'm in my periods, I have no sanitary pad. The boys will laugh at me in school, so I stay home. So menstrual hygiene has helped the girls to stay in school and have equal chances like the boys. But also, as we maintain the girls in school, we're also fighting the stigma. We want the boys and everybody else to understand that menstruation is noble and normal. It only shows that I am normal, I'm a normal girl, I'm very fertile, I'm going to be a mother in future. So our partners have helped us to ensure that the girls are staying in school. But at the same time, we try to help in terms of policy implementation or sensitization about policies. For example, when we have the SGBB policy, when we have the gender bill, we ensure that we go out in the community to sensitize the community members. For example, in Kagamega County, we have gone to the community using the MCAs. We have sensitized all the MCAs about the SGBB bill, and therefore they are helping us to disseminate the information to the community. So as LREB spouses, we are not just sitting back as flower girls, like some people imagine we are not. So we have taken up our responsibility to ensure that we support our governors by making sure that the girls stay in school and they get the same opportunities like the boys. Okay.
Dr. Tuoma, let me bring in on this because you're the MHM champion there. How best should LREB now work in ensuring a lasting solution for the rights of the girl child?
Thank you, Trevor. It's true, I'm the menstrual hygiene ambassador for the LREB region. And one of the things that we have tried to do is to come up with policies and programs that we domesticate as a region, and even as a country. We benchmark on each other. We have said that we needed most of our counties to have clear policies on these issues. We compare notes. We're also saying that we make sure that the programs that we are having are not just on paper, but we are able to budget for them. And one of the things that we have done is to support the LREB counties to make sure that even during their CIDPs, the County Integrated Development Plans, the issue of menstrual hygiene is captured as an item that needs to be budgeted for, and with clear programs that can run, some of which you have had the First Lady of Kakamega mention. And in the process, we have been able to have those outreach programs. We had meetings in Migori, we had meetings in Busia, in Kisumu, and also, I mean, the First Lady's spouses group, they have been also having various meetings in various other places. And one of the experiences that we have also seen is to leverage on the successes that have been there. You have heard the statistics that have been read. But if you listen to that young girl, there's a time when some of these challenges were like a death sentence. But because of the programs that have been put in place, we have been able to mitigate and make them now manageable, that you can live with some of these conditions truly. But to also help in reducing some of the issues like you are talking about, these gender-based violence and all that, is to try and demystify these natural biological conditions that our girl childs normally have. Because it's through sometimes some of this discriminatory and stigmatization that really promote some of this behavior that poses challenges to our girl childs. Like you have had most of them when they're having early pregnancies, and you put it correctly in some of our region, it starts through this thing of thinking that your biological clock is something that is a secret, it is something that should be stigmatized. And with time you find a child maybe being exposed to behavior that leads to early pregnancies, that leads maybe to reckless sexual behavior. So immediately we have these outreach programs to show that these are normal things. There's a time I asked people that today, if you wanted to get a partner for your child or something like that, and you're told, would you like somebody who mensurates or one who doesn't mensurate? Whom would you go for? You get what we mean? On one side it is good, on the other side you want to stigmatize. I was asking parents that tell me today, if you went out there like it used to be before, that you are looking for somebody, and then you are told that this one does not mensurate. Si utatafuta ule ana mensurate. Ama iko namna gani? So why do we stigmatize this thing and even try to take advantage? And in part of my engagements, I've also realized that it's something that if we don't talk about it openly, like I walk around today, I left my kit. When we talk about these sanitary pads, simple things like those. I was told in some places, even border riders use those kind of stories to even get some of our girls into reckless behavior. So it is our duty as counties to make sure that those kind of things is not a privilege, is something that should be availed. And I remember also attending a caucus, and I didn't think it should just be a ladies' thing. And they said, you know, when we were facing challenges of HIV, we would go to public washrooms and places, and you'd find, you know, these protective condoms kept. Are you getting?
For free.
For free. So why is it that when it comes to menstrual hygiene, we can also not look at it like we should be able to provide? at affordable prices, or even be able to provide them the way we did that.
Yes.
And then the issue was that maybe the policymakers are just men, and they are still...
So they may not understand.
They may
the
not
magnitude.
understand.
Yeah.
And that's why I'm trying to make them to understand.
Okay.
By being a champion of this menstrual health. So that we understand, because these are our children, they are our sisters, and when you look at statistics, when somebody tells you that, you know, somebody cannot attend school, you can't attend work, when you are going through your just normal biological cycle, and it's because of all these stigmas that people put around. We should be able to eliminate that.
Okay.
I remember I was reading somewhere, one of the top athletes, I think I'm forgetting the name, from Britain, and during the race, she didn't do very well. And when she was asked what has happened, and you know, she said, it is one of these ladies' things that I was having. So, you know, it ended up giving me some cramps and I could not run. So you see, these are things, they are challenges that are there. They are normal biological things, and we can work on them. So as counties, we believe that we must mainstream this in our budgets. We must do these outreach programs. We must benchmark, like now in the LREB region, we are even coming up with an award for the county that is going to have the best policies, the best programs on promoting menstrual hygiene. And I think we'll be doing it somewhere. I think we were supposed to do it in November, somewhere around there. So that we benchmark on each other, hold each other to account.
All right, let me bring in Dr. Shaheen on this. Dr. Shaheen, 90% of the new HIV infections among children are from pregnant and breastfeeding women and girls. How then, what kind of strategies should we put in place to ensure that there's safe breastfeeding practices, but at the same time, the mothers are still on their ARVs at the same time? How do you balance that?
Thank you, Trevor. First of all, let me start with commending Vivian for sharing her very compelling story, a story of a courage and hope and optimism, and it resonates with many, many girls in the region, in LREB, but elsewhere in country. So thank you so much for sharing your story. Coming to your question about, so what are the strategies, whether the strategies really worked, or there's a lot more that needs to be done to ensure the strategy works for the triple threat, addressing the triple threat. And as you heard, all the esteemed panelists have very beautifully laid out, including the leadership as men, as Governor Busia was speaking, and Kericho, how as men they're able to optimize and leverage their leadership. I think that's a very important message that is going out, that it is just not left to the women to fend for themselves and to look for solution. It's important because the perspective, the way they look at perhaps is not the same the men look at it, but we do have an examples of role models where conversations like this is happening, you know, and at this level, at this point in time, which means there's a lot that is working. First of all, as you mentioned, Trevor, this whole notion of triple threat is itself so complex. It is easier said than done. It is, if you talk about the context that has already been laid out, in a context in a society we are talking about of a polycrisis, multiple crises that we've seen, which is so very connected to the issue of inequity, poverty, lack of opportunities. You've seen droughts, we've seen floods, you know, we're talking about El Nino, we're seeing cholera, public health epidemic, or polio. I mean, there are constant crisis after crisis, the climate crisis that also contributes to the context. Now, when this girl, when an adolescent girl who's not only being impacted by the sexual and gender-based violence, but also is being an HIV affected, and on top of it is an adolescent who's pregnant, and is from a household which doesn't necessarily have the means and wherewithal and access to various opportunities. The girl drops out of the school, have limited access to or no access to health services, to nutrition, to water, even stories like when the girl goes out to fetch water a few kilometers, that itself is not very safe. And we've heard this story is not just unique to Kenya, but elsewhere.
Yeah.
What is important is how do you ensure that the girl who's been, being affected by the triple threat do have access to early treatment, do have access to early services, diagnosis and screening, so that you're able to identify the complexities and you're able to provide the services thereof.
Yeah.
You're able to provide also importantly as much as clinical medical information that is required for the adolescents to make an informed choice about also ensuring that it is perfectly normal to breastfeed, exclusive breastfeeding for the first 6 months, even if the child is being identified as HIV. What is equally important is the need to look at that you're speaking about those actions, about those services, ensuring that the child is back to school. It's not just enough to say that we institute. It is an important step nonetheless, I don't undermine it, that scholarship or fellowship be given to teenage, young mothers to go back to the school. But we also see there could be a negative repercussion for that. And how do we therefore be mindful of the policies and have a more sensitive service providers, address the issues of social norms, reach out to the council of elders, reach out to the Morans, who are one of the key constituencies, like what the panelist mentioned about your stakeholders, and not just about those who have the power to make policy changes. Even those are from the community institutions.
All right. And I'll open the floor for recommendations and questions in just a bit. But Governor, let me come back to you. And you started this conversation by saying sometimes just poverty pushes people into the triple threat. So how do we end the triple threat? Is there a policy gap? What do you recommend going forward?
Well, first of all, when you talk about human behavior, basically, and sometimes we may not have proper prescriptive ways of looking at it. And the one thing that I've always advocated for is education. Access to knowledge to the girl, that this is my body and I have control over it, and give voice to that body. In one of my teachings in the university in my other days, and I'll persuade some of my audience who are here in the university, there is one brilliant writer called Adijie Chimamanda, who wrote a text called Americana. In one of the instances that I could relate to this situation, Opinse took the girlfriend, Ifem, to the mother, who was the university lecturer. The mother asked the lady, Ifem, that I know you want to have sex with my son, which is very good, but do you have a condom?
Straight up.
So the lady got scared, because she was also an undergraduate. She wanted to take off. The lady proceeded mother proceeded to tell the lady that in an event of pregnancy, you will be the one to serve her, because the boy in Africa will escape. So the parochial, packaging of it. So for me, I would raise that we do education to the child. Let this girl, as early as primary school, understand who she is, the repercussions of these situations, so that those who may not be like Vivian would have an opportunity to make a conscious decision out of their activities. Thirdly, I'll give you my own family example. The first lady is here. One time I was preparing to work, she called my boys, the two of our boys, and say, look here, Dad, if anybody touch you here and here, come home and report. So I sip another tea and look at it, and where she was pointing that if somebody touch you here. So the parents should come out strongly and place their boys and girls without any fear that this is how you should conduct yourself. Now, when you talk about poverty, I would want to say, much as we say that poverty could be one of those causes, even children from affluent homes serve as the same. But within our own counties and economic bloc, we must come out strongly to begin them to say how we have given the sanitary baths. How do we reach out to those children in our primary schools that cannot afford food? I have seen, for example, Governor Sagaja giving out, the
school feeding program.
The school feeding program.
Yes.
It is an idea that even within our low regions, like I know Bungoma, Bomet are doing the same.
Yeah.
It is an idea that us from this region, we must think on how we are going to feed these children. So that away from being lured to sanitary pads, stopping that, we also have them packaged in school and they are well fed. And then as we do so, what we have done in Kericho County, for example, we have moved ahead and we are just recruiting by next week. We are admitting 3,000 youth. These are 100 from every ward into vocational training centers, which we are paying as a county government. We are targeting those girls whom probably at class 7 they had babies and they are now vulnerable, because like in Kericho, when you get a child at class 7, you are condemned that your life is just done. The next thing is to go plug tea in the village, and within the next few years the girl is competing with the mother for prenatal services together. When the mother is doing the 4th child, the daughter is doing the 2nd child. So my thinking as the governor is that how then do we harness this one who already is in this situation by giving a life? So we have said, and I've told the parents that bring in these children, we train them in salon. Through our county enterprise fund, we give them 100,000, let them go and open a salon somewhere and begin to have that financial independence so that she can have a position about herself. We are also looking that away from putting them into education, that we can drive them into some sort of business, while at the same time making this girl understand that even in the absence of a job or a business, you can still hustle through training in this manner and you can make a life of yourself. But out of it all, make sure that your body is more important than any other thing, so that it doesn't become a site of gratification. Let me end by this. The way we commercialize the woman body as a space of sex, sometimes also alarming even as a nation at the Today when you go and watch the television, the glorified girl is the one who is able to maybe describe and package in this manner, that maybe brown like this, she can shake her body like this manner, and then we create then a mind of pictures in the magazines of this and this, and this other one, and money, and this one otherwise there, it remains suppressed. So for me, I look into the whole thing of packaging the woman as a space, so that we're able to rethink and make this woman dignified in a sense.
All right.
Thank you.
Dr. Masha, what do you recommend? Because governor is recommending a rather straight-up approach, like just deal with those issues where they are and name them as they are. But we know that that has also been a bit controversial. There are some parents who are against sexual reproductive health care to students, saying that they're too young, they don't need to be told. What do you recommend going forward?
Trevor, I think the challenge we've had as a country is where we have run away from our own solutions. I think the consensus we have from religious leaders to everyone, regardless of where they come from, is that we need to educate. And the controversy has always been, what are we educating about? And that is where we don't agree. But we don't agree because we start our conversation from education that we are defining elsewhere. So the answer is what Governor has said. We know the elements that we need to teach. It doesn't matter what we call it. Family life, sex education, our own homegrown local names. What we must do is that we have to fill in that education gap at home, at the church, at the religious leaders. But secondly, I want to move the conversation from where the governor has left. So this is the girl we are giving autonomy, we are giving the agency. But then the environment around this girl, whom we have taught, then has perpetrators. So we need to move to those perpetrators. And there are very few. We always keep saying, not all men are rapists, isn't it? I think all the men in this room are very good men. So given that there are very few men, what we do We then go to Governor Otoma's where he's saying we don't accept that it is okay for those who are defiling our girls to continue. So once we refuse to accept that it's normal, once we, as a society, begin to point out this is a criminal behavior and it has to be dealt with, then we move to the next step, which we are talking about safe homes, safe schools, safe churches, safe roads for the girl. Because once we've taught her, the next thing is then to prevent her dignity being taken away from her. Like if Vivian shares a story, again, by where she doesn't have the power to protect herself. And then thirdly, it is then where we are talking about institutionalizing policies that allow us to equalize. And one of the things that we must admit, most of us will not be here where we are today if there was no government policy that tried to equalize us, to give us loans for help to take us to universities. So those policies are very, very important. Policies that understand that there is a background that you come from, that unless you're lifted through a system of governance, you can never be able to come out of where you are. And that is why we are talking about transition to work. And this is something that we must talk about openly. Because we are also beginning to see, when you take our curve to the age of 29, again, the vulnerability starts there. I've gone to school, I have my degree. Now what? What is happening right now is that because of lack of a system that allows us to remember, there's a girl who finished school in 2016 still at home. And the one who is in 2020 maybe may come from my family, and she's given the job. The one from 2016 stays at home. They get frustrated, similarly to boy child. So what we're saying is that transition to work must be part of this conversation of triple threat, because again, there are those then, even when they have been passed by the sanitary tires program, there are policies that have been put in place, then they are left hanging before they acquire the agency to be able to be on their own. So it's a triad challenge we have, and most importantly is the president has given us direction. He wants us to end AIDS and new infections by 2027, ahead of a global target of 2030. And the only way out is to have the successes you're seeing from this region. I was really impressed to look at some of the counties, 92% reduction of new HIV infections by like you look at counties for those adolescents from Homa Bay, Kisinyamira, there are counties that are still doing very, very well. How do we ensure this is happening across every girl, across every county? So that is the bottom line, that we have conversations that are so open. But then again, let's have homegrown solutions. Let's argue about homegrown solutions. So that it's not top down, but people are sitting down and saying, if it's the auntie who is supposed to say, if it's the governor's wife who is so bold to with the children, let it be whatever she can teach, then she's teaching the right thing. And we encourage that kind of education to be formalized. And lastly, I think we need to remember, we have an organized group of children in a school. We cannot have a child go through from class 1 to class 8 without the necessary skill of an education she needs to acquire of how to prevent a disease, of how to take care of her own body, part of that which is sexuality. And then follow her outside there in the community to give her the same education we would have given them in a group of class. So that is an issue we have to sort out as a country. We have to agree as religious leaders, as culturalists, as everyone in this country, that these stakes are all ours. And I want us to conclude by saying, on my side, that this is an economic region block. 35% young people. When you count the assets of this region, we must count the young people as an asset, because it is the asset that is a future. And once we lose that future to poverty, then we'll not get to be able to get to the economy that we want to grow.
I'll come to the rest of my panelists to hear your recommendations. But let me bring in the audience here. And Victor Nyangaya is here, CEO LREB. What do you recommend going forward? And how do we end the triple threat? And that's what I'd like to hear from the audience. If you all have just a minute each to give us recommendations. Deputy governors are here, first ladies are also here. We'd like to hear from you as well. What do you recommend going forward?
Thank you. Thank you, Trevor. Mine is very brief. The threat,
end the triple threat, that's a catchword here. Indeed, in LREB, as the CEO, we have interrogated that, and the solution may not be permanent, but it is something we hope to achieve, and more so when we meet here beginning today. By the end of the day tomorrow, our hope and belief and goal is that our governments in the 14 in this block would be able to enhance their budgets in the gender ministries under them, so that we move away from situations where politics or politicians give out sanitary pads during electoral process and then go to sleep until the next 5 years. Because menstrual hygiene does not only happen during elections. It is throughout.
All right. Thank you, sir.
So we want very predictable arrangement in each and every county. Put in a budget to sort out that, so that it's not goodwill. It is a policy.
All right. Let's hear from the First Lady of Kericho. You're the one who had the guts to point out the things that should not be touched to your sons. What do you recommend going forward to end the triple threat?
Thank you, Trevor. What we do, or as First Ladies and as a First Lady of Kericho, just like as my colleague Professor said, it is about advocacy. We go to the crossroads and give that education. If we are able to get girls like Vivian, so that the rest can learn, that is can happen to anyone, and how can we solve it?
All right.
So, raising awareness and talking about it each time,
advocacy,
being the voice of the community.
All right.
Yes.
Thank you. As you pass the microphone to the Deputy Governors who are here, there's another microphone back there. If you have the microphone, just raise your hand. But yes, go ahead, ma'am.
Thank you so much, Trevor. My name is Pastor Jennifer Batini, Deputy Governor Bungoma. First, I want to say we agree that it is possible for us to end the triple. First, we should keep the conversation going. The way we continue doing sensitization in our schools, doing mentorship, and bringing on board even the male to help us in the sensitization, we are going to end the threat. For many times, you know, we've been doing these things alone as women. For example, when we have International Women's Day or International Day of the Girl Child, you realize it's only women who attend the event or only girls. But we want to change the scenario by coming together, all of us, so that when we work as a team, we are going to end the threat.
All right, you can pass the microphone. Let's hear your recommendations. If you have any questions, you can also pose them. I know there's another microphone back there. We will come to you in just a bit. Yes.
Thank you, Umbija. My name is Philomena Kapkori, Deputy Governor, Trans Nzoia County. First, I think I really want to appreciate that we have this conversation, and I totally agree with the earlier speakers. Now, one of the things that I totally agree with and I really advocate for, it is a conversation for all of us. It cannot be the females only. And I think, as my colleague here has rightfully mentioned, most times you'll find that it's only the women that really, most times. And I'm happy that His Excellency has actually demonstrated that we have some men who are doing it as well. But we want to have more men coming to the table. This conversation has to involve all of us. Take, for instance, the socio-cultural effect, especially on GBV. And I'll give the example of FGM. When we have our children, even today, and from my community as well, and which also spills over to the Bungoma County, where we have girls actually running to hide and have FGM done on them. Who pushes them to do that? You'll find that the men who want to marry them will tell them, you must do that. So these conversations have to be, you know, for all genders. We also have the other thing that affects us, and I want to really just give me a few minutes on this. The issue of education, I think we have to intentionally and deliberately have gender responsive policies and gender responsive budgets that support these initiatives that actually help in terms of balancing this.
Okay.
For instance, when we have something like Elimu bursary, we must deliberately make sure that at least it balances out. We have a good number of girls also benefiting from that. I want to give an example of something like water, for instance.
Okay.
The people who are affected, of course, most when there's no water are women. They have to go and fetch that water. Now we have our girls coming from school. They have to look for that water from wherever they can, I mean, how far it is. So that they can wash clothes, cook, and at the end of the day, still do their homework. So of course, you can see that the education is impacted there. So we must, even as counties, be deliberate in terms of where we even put some of our budget.
All right.
I also want to mention something on poverty.
Very briefly, yes.
Yeah, very briefly. And I think even as county governments, we must be deliberate also in terms of how do we support our people. Do we come up with initiatives to support the small business women with even funding? Those are some of the questions and some of the things we should be able to consider.
All right. There's a microphone back there, and also I'm looking for Lopa Chirono, Youth President, Kericho County. Where are you? Yes, there's a microphone that should be brought to her, and let's hear what she has to say, because you're the Youth President here, so we have to make sure that the host county speaks. But there's a microphone back there. If you have a question or comment, we'll come to you over there. But yes, go ahead.
So thank you so much, Trevor. My name is Lopa, the Kericho County Youth President. I was going to ask a lot, but unfortunately, my governor has really answered me 100%.
Fortunately, actually.
Fortunately, yes, sorry.
Yes.
So I really want to appreciate Vivian for her story. I was really touched. I've heard her severally during so many occasions. Now, I really want to encourage or rather request our governor, if there's a way we can bring in, someone like her, she's tortured. She's somehow going a very hard time. She's never seen her mother. Saa zingine she thinks a lot. So can we find ways of maybe encouraging such people? And we really need to fight to take back teenage mothers to schools. Because I'm sure even her, she's seated here right now. Maybe even her, she wants to be an MP sometime. She wants to be a governor like you. She wants to be like Trevor. So this can only happen when we have brains. So we also need to encourage our teenage mothers to go back to school.
All right.
And I really allow me appreciate our women rep for this one, because she's been doing that. She's been talking to the teenage mothers around our county, and I'm so thankful. So Governor, thank you, because you answered my questions.
Okay. Governor, it's a challenge to you, so we'll get reconfirmation there. Yes, there's a microphone back there. There's a hand that's been raised. Yes, start with your name and your concern or recommendation or question.
Good evening. I salute you all in the mighty name of Jesus.
Please stand.
Hi.
Please stand.
Thanks, Trevor.
So that we see you. Now you can greet us in the name of Jesus.
Good evening. I salute you all in the mighty name of Jesus. Thanks, Trevor, for golden chance you've given me to air out my point on the topic. My name is Elvis Bosco Wanyonyi, a third-year student in Kenya Islands University, taking Bachelor of Education in Arts, that is Kiswahili Geography, coming all the way from Bungoma.
Okay.
Yes. So Paul Otuoma, His Excellency, is my friend. Yes. So I'm happy. I'm a highly passionate journalist in making, that is Sports Guru Bosco. Let me first of all say it's our girl child day, so let them feel free to share their inquiries.
Okay.
As the topic suggests, ending triple threat. Gender-based violence, HIV infection, and early pregnancy. My question goes straight to the institution, that is Kenya Islands University, because most of these ladies, at times they might fear to bring on board their questions maybe, or their issues.
Okay.
So we'll have some suggestion boxes or some inquiry boxes that might be put somewhere, so that they might air out their points.
All right.
It would be very great. Thank you.
Good. The Vice Chancellor is here, so I'll give him a chance to respond.
Obita and Polo Tuoma, His Excellency. Thank you, thank you.
Thank you very much. Right. Yes, there's another question there. Then we'll give the Vice Chancellor a chance to respond. Yes.
Okay, thank you. My name is Brian Fidel, a resident of Kericho, and my question goes to I see the floor is full of, because we are celebrating the Day of the Girl Child. So, because I heard that most of them, the girls, go through challenges after getting infection and everything. So what are your plans to make sure that those girls are reformed and also get a new chance in life?
Okay.
Yeah. To Dr. Masha. Thank you.
All right. Dr. Masha.
Good
yes.
evening.
Please stand.
Hello, good evening.
Good evening.
My question goes directly to the governor. And
there are two of them here.
Yes.
There are two governors.
The governor for Kericho County.
Okay.
Yeah. And I would like to ask him how he plans to work with the NSDCC or other organizations supporting the girl child to sensitize the workers in the multinational tea farms on their sexual reproductive health rights, bearing in mind that there was a BBC expose on their alleged sexual harassment.
Okay.
Thank you.
All right. Let's take two more, then I'll let the panelists react, and then we'll come back if time allows. Yes, over there. Yes, go ahead.
My name is Winnie Mudeu, a fourth-year student, Kenya Islands University. My question goes directly to His Excellency, Dr. Eric Mutai. So, how are you planning to invest in girls' rights? What are your methods of propulsion on investing in the girl child?
Okay. All right. Maybe just one more over there. Then give Vice Chancellor a chance to respond. There's a direct question for him from the Kenya Highlands University. Vice Chancellor, the microphone is behind you. The host VC. They were wondering whether they can have suggestion boxes.
Yes, we do have suggestion boxes. We might need to add more.
Thank you so much. It's straight to the point. And let me come back here, then yes, one more, then we'll come to the reactions.
Thank you very much for this opportunity. I want to congratulate the panelists for the insightful information that we have received. My name is Clara Lagat from the University of Kabianga. I would like to express my concern and a question on the boy child. We know that teenage pregnancies most of the time happen with the teenage boys. What do we have as strategies to ensure that boys also are brought on board in terms of counseling after pregnancy? Another one is about cramps. We know that we are handling menstrual hygiene. What about the cramps that we see these days affecting girls? Thank you very much.
All right. Let me get a reaction. Prof, and I'll start with you, but there's a burning concern. Yes.
Yeah, thank you. Sorry.
Sorry.
Yeah, thank you very much.
And then we'll give you the microphone. You seem to be the activist on this side. Yes.
Yeah, my question is directed to our governors and as well what the LREB will mention in terms of what I'm going to ask. A lot of the times, okay, I'm Dr. Wangila Fanis, also from the University of Kabianga, the director in charge of gender. And from what I do, I've interacted a lot with young girls and women as well. And of course, even the men. Yeah, but one thing that stands out is our leadership. The impact our leaders have towards solving these issues on the ground. A girl comes probably because our governor, Otoma, has mentioned the fact that sanitary pads are being provided. But in the case that this sanitary pad does not come, this girl gets pregnant. Who is impregnating this child? One of the leaders. I don't want to mention which level. So what is this that our governors are doing in conjunction with whichever other leadership that offers security to ensure that even when the challenge is on the ground, it is not this leader who is stopping these issues from not being propelled, right? And so what will LREB put in terms of their framework to ensure that even in the 14 countries, our leadership have a package, either of education, training, or whatsoever, to ensure some of these things are prosecuted.
Okay. All right. Let me hear from you, then I'll get a reaction from my panelists. And you can react to any of the concerns that have been raised, and I'll start with you.
Thank you very much, and good evening, Trevor. You forgot about the CEC members. I have my colleagues here.
Yes.
It's important that you remember them. I'm Dr. Otumba, CEC member in charge of Education, Youth Affairs, Gender and Social Services, County Government of Siaya. My question goes to my chairman, Dr. Eric Mutai, who is my friend. One of the things that we need to do for our young girls is training on positive behavior change. What plans do you have as our chair, Council of Governors, on that area? And as you do that for the girl child, please also tell us what you would wish to do for the boy child.
Okay.
Because they are all our. Very
all
much.
Right. All right. Okay. Prof, I'll start with you, then I'll come to Governor Mutai, who has most of the questions coming to us. So what do you recommend going forward? And there are quite a number of issues that have been raised. There's the issue of the boy child as well. What are you doing to empower the boy child?
Thank you, Trevor. Thank you for the questions that you have raised. First, I would like to talk about education. When we talk about education in this case, we are asking what kind of education are we giving the young girls and boys, for example. Let us be able to give them knowledge about who they are, what it means to be a girl or a boy, what are the methods of transmission, for example, of HIV/AIDS, how do you take care of yourself as a teenager to prevent yourself getting infected, and also counsel them in the event that you are HIV positive or you have become pregnant, counsel them to go through it positively. At the same time, let us be able to help them get access to health care. That I am expectant, where do I go for help? Yeah. If I want to deliver, whom do I speak to, where do I go to? So we want to use a multi-sectoral approach to these challenges, the triple threat. We have bring in the issue of education, and we are targeting particular messages for education. We are bringing the issue of health. When the girl is raped, for example, what does she do? Whom does she go to? How does she get help? Many times they'll go and wash or bathe, yet they're destroying the evidence. So we let us educate them to be able to know that when I'm raped, I first go to the hospital, get help, then I go and report to the police, then 3 other things can follow. Mm-hmm. Then also when somebody is HIV positive and we help them get access to medication, for example. At the same time, we are blaming poverty, and that is the key thing that's making girls get pregnant, girls getting HIV and AIDS, girls being molested. So let us be able to help them get empowerment. Yeah. Like Governor has said that they are going to initiate TVET scholarships for the teenagers in Kericho County. Mm-hmm. We help them to get economically empowered. Then they'll not be violated, they'll not be mistreated, they'll not be taken advantage of by the men, maybe because I have no sanitary pad, I want to get it, and somebody wants to give me 50 bob or 100 bob. Yeah. In the event, the sanitary pad will not even help me because he has slept with me and I've gotten pregnant. Okay. At the same time, we want to bring on board the legal frameworks that can help these ladies or these young girls get legal aid in the event that they are violated. Okay. So the issue is a multi-sectoral approach on the challenges that we have. Okay. But besides that, we have to bring the men on board. You know, I am in class 8. My desk mate has made me pregnant. I drop out of school. The boy continues the education. He's going to go to university and the like. So the men have to speak to their fellow men and tell them that we have to take care of our sisters. Yeah. So they have to be their sister's keeper. Okay. And I like Governor Otumba what he's saying, that he's championing menstrual hygiene, which is good. Yeah. But let us bring on board many more boys, young men, to speak about the same things that we're going through in the community. Okay. At the same time, yes, we have to ensure that these perpetrators of teen pregnancy, especially, must go through the legal process and the ladies get justice. Okay. Just 1 minute, yes, Trevor. the youth president mentioned the issue of the integrating teenagers back to school, teen mothers back to school. We in Kakamega, we are trying the same. We have tried to reintegrate teen mothers back to school, some in schools, some in polytechnics.
Yeah.
Unfortunately, the community is taking it positively and negatively. Some say, she's encouraging many more to get pregnant. But we're trying to make sure that these girls who have dropped out of school, they have a second chance to go through education and just take care of their lives in future.
All right. Dr. Tuma, let me bring you in on this. And there's the issue of the boy child, number one. And Nyangaya, the CEO, LREB, mentioned something interesting. Deliberately having budgets in your budgeting process. You mentioned the CIDP, the County Integrated Development Plan, and there's also the ADP, the Annual Development Plan. But is it something that is cast in stone, or do you as governors arbitrarily decide that this one I'm going to put some money here, that I won't put money there, and then the empowering of the boy child as well?
No, I think, Trevor, I think as what Bagaya said is that this should not just be at the whims of an individual, it must be mainstreamed in the policies. And that's why I say that within the LREB region, we're encouraging all counties to make sure that during their CIDP planning period, the issue of gender, the issue of menstrual hygiene, specific programs are budgeted for and they're implemented. And that's why I say that we need to benchmark on each other. And that's why, again, we're saying they must be supported by clear policies on what we want to achieve. You saw a lot of statistics that were given here on what has happened and what is happening and which county is doing what. And they always say if you can't measure it, you cannot achieve it. So we must really have clear goals on what we want to achieve. The other issue that has just been mentioned on the issue of the legal process in event of violation, even of girl child and even boy child sometimes. We have seen cases, it's true, whereby sometimes people use positions of influence to take advantage of vulnerable members a lot of time. Either somebody is going to get bursary or somebody needs some transport, and in the process you find a leader who is supposed to be helping them, the ones who are taking advantage. And sometimes because they're in position of influence, then they even want to influence the justice processes so that nothing is done. Because in this country, we all know that trying to touch an underage person or a school-going child is a direct defilement. You know, the minimum sentence, I think they start from 20 years or something if some lawyers are here. So people know the consequences, but what they do is that they try to influence. And that's why it becomes very important that we also must make sure that as we make these laws, you seal all those loopholes. So that somebody knows that there will be consequences in case you are doing behavior that is not acceptable. And I think maybe to be specific, some of these areas, I know there are some leaders who have been taken to court over this kind of thing. Now, how do you protect the witnesses? You know, these kind of things that we are talking about. We need to put proper legislation in place to be able to do that. And even we as county governments, I tend to think we must support programs that really enable or make it difficult for anybody to escape justice in the event that you take advantage of either school-going children or underage children.
All right. Dr. Shaheen, what do you recommend going forward? You've had the concerns raised from the people as well and what the panelists are saying here. What do you recommend going forward?
Yeah, first of all, I think it's been said, but what we need is a whole of a systems approach. While this is a triple threat, but I guess as Governor mentioned, when you're making your CIDPs and annual book development plans, one is at the county level, what are the financing opportunities through your health, through your nutrition, through your ECD, all of those windows which are devolved functions where there is a possibilities of ensuring that that earmarked fundings are being said. Because currently, we're not in a situation where we could do a silo financing and silo programming. It's an era where we need to do an integrated financing, integrated programming, and integrated partnership. If you have fund, for example, that somebody, a donor is giving a fund to do a health program, maternal and child health, we need to see how we increase and expand that envelope to look into adolescents' health as well. So that's one approach that we need to see. And I think a lot being said about, and there are examples, there's nothing new, that in some counties, especially when I traveled around and I was in West Pokot, I was in Samburu as well as Homa Bay, I've seen, one, the leadership matters, where the leaders have taken, the governors have taken a lot more obvious role in bringing all the young men and women, but also in the remote sub-counties, where some of the community-based organizations and local national NGOs, together with the county government, are taking that extra mile to engage with the community men, elders, the council of elders, the Morans, and part of that engagement. And lastly, if at the national level, the government at the national level is planning to do a campaign, then it has to be a context specific.
Okay.
You cannot have a program which is a Homa Bay context specific. The same template be more useful for a Samburu or West Pokot.
Okay.
So the counties have to inform the national planning, campaigns, design of it, rather other way. I think therefore all hands on deck. There's the need for collaboration between private sectors, academicians, university students, the young people's organization with the agency and voice. All of them need to come together, and more importantly, the possibilities of addressing through various other opportunities and windows is there.
All right.
Thank you.
All right, Dr. Mash, I'll come to you, then I'll come to Dr. Mutai because he has the number of questions. But there's one about empowering the boy child. How do you now have that balance?
Thank you, Trevor. I think when you look at the statistics we have from the health sector, especially in the matters we have spoken, we find the boy child also, first of all, we see increasing number of sexual violence and gender-based violence cases, especially against the boys. We are seeing those cases. But then we also see that boys and men who also have HIV, we lose them earlier. We are not able to diagnose them early because you find them in the clinic coming for tuberculosis treatment. And so we have an issue of lack of education of the boy child also in terms of access. But I want to go back to the triple threat and say where we find, again, the boy child. We again find the boy child in a juvenile prison, where, as the speaker has asked, is young. We had one case in Migori County where one boy, 17 years old, had impregnated about 8 girls in school. And the same time, I mean, they were all pregnant, And I was trying to look at that case study, and this boy is an orphan, and he left school and went to some mining, and then he bought a motorbike. But he's very handsome, and the girls, of course, liked him. So it brings us to the concept you're calling Romeo and Juliet concept. How do we deal with that within the judiciary corridors? And how do we then ensure that boys are also well informed of the legal environment, of what they can't do? And that is the role that we have to play as a whole society and the whole government. So the triad of the triple threat involves the boy. The other element, when you ask the boy who is a perpetrator, who has also grown to be a man, why they violated it, point to the issue of drug and substance abuse. That's an issue we know as a country is becoming a very, very serious concern. So again, there we have to do that issue, because when the boys also stop, they come to the university, they drop off. If they drop off, they get deviant behavior. If you take them to prison, by the time they come out of prison, they're hardcore criminals. If they're hardcore criminals, they are likely also to commit sexual violence cases. So as we speak of the girl, we also have to speak of the boy, because it's a plane that goes two way. Then the last one I would mention is a question I was asked directly about, which she has, Professor has answered here. about the return to school of adolescent mothers. There's one thing that we must avoid doing where this return to school is delayed. If a girl was an A student and she gets pregnant and stays home for 3 years, it means if you take her back to school after 3 years, she'll go to class with the people who are much way behind her, and then she'll be stigmatized. So the concept of return to school should be almost immediate. And I think Homa Bay County has very good examples. I met more than 200 girls, some that had delivered, like, you know, and there was a concept of who can take care of the children, and then they return to school. So the answer to the question of what we do for the girls, there is no other way. We have to return them to school because education is an equalizer.
And return them on time.
And on time.
Okay. Let me bring Governor Mutai here. There's many questions for you. How are you planning to work with NSDCC? How are you going to empower the women investing in the young girls? How are you going to ensure there's training for positive behavioral change and the boy child?
Thank you so much. When our county youth president asked a question, or rather a comment, citing the case of our hero today, Vivian, on infected persons. We are working with private sector and also community-based organizations such as the Plight children. And one of the things we are doing is to get the statistics in the county on those who are already infected, and children like Vivian, who their only crime was to be born. But out of it, she has struggled and make her life to 22. So what we are trying is to see how we can, you know, reduce the burden on them by either supporting them through school, or also through our bursary scheme supporting them through school, or those who are not learning or not in school, we put them in some form of business so that they can able to make their life. We have done with some few, and we are still mapping out exactly how many that we have as a county, so that as we structure our bursary schemes and our county enterprise scheme, we are able to put them in place. On matters, somebody has asked a good question on the multinational tea estates and the BBC sex expose. True enough, it was our lowest point as Kericho County, and it was very hurting to see women forced to go through such situation. We had a conversation with the multinational organizations, Ekaterra and James Finlay, and we had to put them on task. What they did immediately was to sack those that were involved. And thereafter, they have come up with measures under our supervision that guides on gender-safe environment. One of the things they have done is to come up with very stronger gender policies within them. They have come up with suggestion books. We have also asked them, and I think they have complied, to come up with sex officers, gender-based officers within their divisions, where women working in those particular tea estates are able to report their problems on time. However, I just want to mention something on this matter. When we tried to pursue with the police, because personally I was in charge of this and I took responsibility, the police opened the files. The women who were confessing on live TV and cameras, they were asked to come and record statements. They disappeared. They never came and recorded. And now these are not children. These are just old women. So the point is, in such situation, it also makes the work for the police very difficult. So my advice going forward, even because these are about children, but these are grown-ups, if you were raped, then you don't need to wait for 2 years, then you come up. Chances are very high, assuming that you have sex 3 times in a week. By the end of 365 days, you would have had them around 1,000 times.
I really like the way you're direct.
You have done 2 years, that will be close to 2,000. It takes a miracle for a police officer or a doctor to prove if rape took place. So the truth of the matter is, if such a situation happened, please report immediately when evidence can still be collected. Okay. I will give you my word. A situation happened last week, 2 weeks ago, involving, I think, a Form 4 student or something in the university. Immediately when the report came and it was reported and it got to my ears, I directed the police immediately. And as we talk now, because that was also one of the senior people, that person is in police custody. And the lady in question was handled in our referral, and she was able to be given, you know, the BEF for exposure. So what we are saying is that when you come out early enough, it can also help to deter the other 333, that is the HIV, because you'll be able to be placed on drugs, and it helps you, you know, so that it saves you from these. Okay. On investing on the girl child, one thing that we've been passionate about, and I think as a region, this is what we're going to take it up even more seriously, is to look for programs that can easily speak to that girl in the village. One of those that I've mentioned is them that dropped out of school, and I think Professor or somebody mentioned that if they are left for a while, for 3 years, they come back, they may not get back to it. But we are saying that it doesn't need you to go to the university to make a life. We can train you as a saloonist. We can train you as a plumber. We can give you hands-based skill and articraft, which you can go home, do cottage industries, do incubation centers, do yogurt or pineapple cheese, and then you sell and make a life. Okay. And that is what we are putting in as a county government. At the same time, we are also, you know, within our blog is an encouragement that when you come to recruitment, and this is also what we did to the multinational tea estates. We asked them, they stopped, and I'm very happy, they stopped this thing where you go, you get somebody there, a manager, to get a job. They advertise. If there are 6,000 jobs, they call everyone to the field, and then they do balloting, which is written yes and no. So you come, all of you, the 6,000 of you, you pick. If you get yes, you could go to work. If you get no, you wait for another time. Okay. So it limits interactions with supervisors and would be people that would employ you. Okay. We are also saying within our own county governments that there is a need, as we do employment, we become as open as possible, so that we have institutions and mechanisms which will also be developing policies within our own assemblies and the county governments, that when we are doing interviews, we don't interview you and look into your face, we look into the size of your body, but rather we interview you based on your brains and your papers, and if you're able to deliver a job in the department that you've been invited to do so. Okay. This will help us. Lastly, is there is what you call the county policing, which as governors within this region would be very keen, and already some counties are implementing it, where we are now having the police and the county government coming together to create one county policing unit, which is chaired by the governor. Out of this, then you are able to speak into these issues within the security meetings, be able to get the chiefs, be able to get the village administrators, and move forward. Lastly, which was very important, it was asked by the CEC, for us to move as a region and have uniformity sort of, or rather almost almost relevance, because counties are unique in their own self, but as a region we have common challenges, is that I'm planning as the pillar for gender within this region and the patron, that we soon have a meeting for all the CECs of respective departments in the 14 counties, and also the committees in the assembly on gender issues. Then we sit together and come up with policies that we implement commonly as county governments. All right. Thank you. All right, ladies and gentlemen, we've run out of time here, but if there's a burning comment, I'd like to give you just 1 minute. There's a burning comment over there. We really run out of time, so I'll only take 3 people maximum. By a show of hands, those are more than 3. So let's start with one here, one in the middle, and one at the farthest end. Yes, burning comment. Where's the microphone, Wasike? Tafadhali, make it very brief, just 1 minute, because we've run out of time. Yes, sir.
In our midst, we have a sizable number of people that refer themselves as transgender. Where do we place them in this conversation?
Okay. Dr. Masha would like to take a go at that. One more, let's take 2 more. Yes, in the middle, the lady in front here. Yes, give her. President ulishaongea. Ni nini lakini President? Okay, yes.
Thank you very much, Trevor. Let me thank the panelists for the time that they have actually articulated the issues that we have actually had. My main concern is about the gender mainstreaming, whereby in some institutions they still have the gender mainstreaming. So I was looking at the case whereby if we can bring the education, then we bring education and we educate the people so that there will be no more gender mainstreaming. That will help our girls and they can have self-confidence in whatever they are doing. Thank you very much. I'm the CEC in charge of education, Bomet County.
All right. There's one at the back there. Yes. Let's make sure we get that farthest end. It's important that we have an inclusive conversation, so let's take that microphone back there. Okay? Thank you. Right, there's another one over there. Yes.
Okay, thank you so much, Trevor. I'm Paul Otieno. My main concern is that we've had victims of the triple effect. What is the bloc doing to ensure that each and every other victim is reached onto and also they get help as they deserve? Thank you.
Okay. Yes, ma'am.
Okay, thank you. I'm Beatrice Langat, representing persons with disabilities. So I just want to ask, please, Dr. Otuoma, Your Excellency, the governor of Busia, where are girl child with disability placed?
Okay.
Do you know that we are not even triple threat? We are quanted threat. We are being misused. This young child is being misused with a disability, and they are the ones who are being done. They are the laboratories. They are the experimentaries. They are being used as a test tube to be.
All right. Okay. Governor Tuma.
I think that's a very loaded question. It's truly, I think, as it has been stated here earlier, that what are we doing with people with disabilities, the youth, the women, you know, that what we are calling the vulnerable group. And it's true that within our governments, we just try to meet that minimum criteria of 30%. But I'm also aware that in the reportings that I have seen, in some places we are not even meeting that criteria, but we need to go beyond. So I'll take it upon myself, and also within our LREB region, and my brother is here, that especially on the issue of people with disability, on some of these issues that we are trying to address, we give it special attention, especially the various challenges of what you are calling people living with disability. Because as you put it, sometimes the access to the kind of informations, programs and messagings that we put out there may not be reaching out to this kind of group.
Yeah.
And as far as I'm concerned, I think that's a gap within our region that we need to address. And I hope the CEO, you are hearing this, that this should now come up in our next council meeting, just to evaluate ourselves on how we are reaching out to people with disabilities in some of these programs that we are talking about. Because as I speak, I think it was a day, yesterday or the day before, when I was just being told in Busia, you know, somebody tried to rape a lady who could not shout much. And if it was not just maybe the drums in the house falling and then her children woke up, maybe you'll be thinking of something else different. So when we talk as counties, I think that's what we are trying to say, that what kind of measures are we also putting in place so that some of our members with this kind of disabilities, they're also able to protect themselves. Maybe even just like a panic button that can be pressed and somebody knows that maybe there's a problem. Because I'm talking of something very live. 2 days ago, I think even if you look at the police cases in Busia, you'll find it is something that was just happening. It was by coincidence. So I take what you have just said as a very important thing that we need to address. And I as I've said, it's just a gap on how we are able to communicate to that group.
All right, Governor Mutai, I'd like to hear your views on that also in terms of supporting persons living with disability, because you have the AGPO system, access to government procurement opportunities, that allows 30% of all procurement to go to women, youth, and persons living with disability.
I agree that there is a need for us to have a conversation. Of course, we've tried as much as possible where we can to have people living with disability intentionally and in preferential way get contracts, including our youth. I'm happy even the lady who is speaking is one of the beneficiaries of such system, because I've employed her. She's now a member of board. She's a member of municipal board in Kericho County, which is also a very positive step. And in last year contracts alone, I followed it up myself, and close to 3 or 4 people were awarded contracts. But it's a conversation we want to take we are not there yet, including even our youth. We are not there yet. But I believe even as we progress, we would want to encourage our youth to understand the systems and the procurement processes, how they can come up with viable companies, how they can put in their papers, so that at the end of the day of our procurement process, this person would be able to do that. But we will do that.
All right. Masha, there was an issue of transgender. Very briefly, we ran out of time completely. Yes.
Thank you very much. So as from the Ministry of Health perspective and from the HIV perspective, we do treat transgender as a group that is vulnerable to HIV, and we group them in a program we call the Program for Key Population, men who have sex with men, sex workers, people who ingest drugs, and transgenders. And so as we do our programs, we also reach out to them. And for the benefit of the audience, transgender are people who are born male and want to assume the female gender, or they're born female and they want to assume the male gender. So whereas the legal environment does not allow, but in the context of the right to health under the Constitution of Kenya, we do give all those groups, regardless of their sexual orientation, of their status, health services and HIV services.
All right. Ladies and gentlemen, thank you so much for making time. We've run out of time completely. His Excellency Dr. Eric Mutai, the host governor at Kericho County. His Excellency Paul Otuoma, Governor Busia County. His Excellency Professor Janet Baraza, First Lady Kakamega. Dr. Ruth Laibon Masha, CEO, National Syndemic Disease Control Council. Dr. Shaheen Nilofa, UNICEF Kenya Country Representative. And thank you all for all the valuable views that you've given. Tomorrow marks the International Day of the Girl Child. Remember, we all have to take responsibility to empower our own sisters and brothers out there. And special thanks to the Kenya Highlands University for hosting us this evening. My name is Trevor Mbija. The extended version of The Explainer ends now, live from Kericho County. Thank you so much for watching. Whenever you want to sign off. Okay.
And Excellency,
as the host governor, you have the right to do that. Yes.
So tomorrow we're having the biggest day in Kericho County for this event. Her Excellency, the First Lady Rachel Ruto, will be gracing the occasion, and on behalf of all the other governors in the Lake region, the 14 of them, we welcome you all to this particular place same time.
All right. Thank you so much. Good night and God bless.